Hello everyone, welcome back to AIPT USA. This is Karthik Yadagiri, your physical therapy doctor. I hope you already watched the introduction to treatment video. So coming back to the first video, that is your ankle. We're going to treat the ankle joint. What are the conditions the patient come to you with you could treat for musculoskeletal system? I would say anybody comes with ankle pain who didn't have an active fracture. Anybody who's been having subacute or chronic ankle instability or sprains. Plantar fasciitis, some of the diagnoses they come up with. Achilles tendinosis, they might come to you for tendonitis, but usually they don't have tendonitis if it's not acute. So these are some of the conditions, including shin splints, anything with the ankle, but don't forget regional interdependence. You have to make sure you do your assessment right, clear out your knee and the hip before you treat the ankle. I'm going to show you 2 manipulation techniques, 2 IASTM methods, 2 exercises to complete the treatment for usual problems with the ankle. The first one is the J stroke. The J stroke's idea is to distract the joint in such a way it improves dorsiflexion. Majority of the people who have trouble with the ankle, knee, hip, back have trouble with poor dorsiflexion. Just by bringing the foot up doesn't mean they have dorsiflexion. Could you pull your toes up to your... Yes. So she doesn't have a full dorsiflexion. They should be at least about 30 degrees. So I'm going to show you how we're going to improve that. The patient will be laying on their back on a table. Go down, lay on your back. So the goal of this technique is to interlock your fingers and stay at the crease, right at the malleolar junction. So right about there, you're going to cup that really well. You can do this in sitting or standing. I'm showing you for demonstration purpose, I'm doing it in standing. You want to just pull your body weight into you. You don't want to force it. You want to take all the slack off the joint by holding it really tight right about there at the crease. Pull towards you and gently take the slack and pull in such a way that you do a J stroke. So it's not straight pull, it's going to down and up because the orientation of the talus and the talocrural joint. I'll show it one more time. If you pay close attention, I'm just interlocking my fingers, covering this whole crease, taking up the slack by pulling it, and I want to pull down and up towards me. That's the J stroke. And the other options that you can use are the tools. How I'm going to treat an ankle, because in most of the patients who have trouble here, they have a lot of tightness here or inefficiency here. The fascia might not be doing well. So the strokes that you would use, first I will start with the concavity and then move to a convexity. So I will gently do a brushing technique on the whole of the anterior area. So it's a soft stroke. It's not hard push. You don't want to feel the weight of the tool is enough to create the change. So you go in multiple directions in that orientation. It doesn't matter if you go from distal to proximal or proximal to distal. You just want to cover the area in such a way that you're not putting a lot of pressure. You don't want to be perpendicular. You want to have about 20 to 30 degrees only. So you do this for about 30 seconds to 90 seconds or 2 minutes at the most. No longer than 2 minutes. You can also go on the calf, which I'll show you when she's in prone, but it's a little different when you go on the calf. So that completes the J stroke. Now when the patient is there, you can also use suction material if there's pain irritation here, and they can ask them to move with the cup. That's one way to treat the patient who has ankle pain, because usually they have trouble here and they cannot dorsiflex. And you'll use the suction posteriorly to improve dorsiflexion, which I'll show you when she's laying prone. So in prone position, as you have seen, the goal is to improve dorsiflexion, be able to move. The other manual therapy technique that we can use is the cuboid whip. It's called whip because most of the time they have trouble at mid-tarsals and also trouble at the cuboid junction where they will feel tenderness. When you hold, you will feel the pain at the cuboid. You use your thumb and your index finger to hold, not like this, but on the side. Hold and push and squeeze. If they complain of pain with movement, look for the concordant sign. You want to hold it well in such a way that you position both your thumbs one on top of the other. Bring her down in the direction like you're going to push straight down and then take the slack and whip it. So that is the cuboid whip. That should help the cuboid move better and the pain is alleviated. And complement it with your IHTM tools by using it on the gastrosoleus. You can do it in straight knee position, bent knee position, but the strokes are a little harder. As you can see, a little pressure. I'm not perpendicular, about 30 to 45 degree angle, but I'm going all the way, not just on the calves, but all the way up to the hamstrings. I could go all the way up to the hamstrings to cover the whole area. I'm not going to do the whole treatment here. I just want you to get an idea. That is multi-directional, 30 to 45 degree angle, and brushing strokes all through the posterior chain. I could use cupping at the gastrosoleus junction and also a little bit laterally and ask them to dorsiflex. Kind of helps the connective tissue layers move better. So you got different options to use here to improve dorsiflexion and be able to do it passively. This old treatment is to improve passive mobility first, and then we'll incorporate the motor control exercises. So you got two techniques, how to use your tools. If it is an Achilles tendon problem, it's a different technique because you want to stress the tendon. So you want to really put a lot of pressure on it and go in a certain direction so the connective tissue of the tendon improves fibroblastic production. So as you can see, I'm not just brushing it, I'm actually using pressure on the tendon all the way up with the smaller tool. And that completes the usage of IHTM, cupping, and J-strokes mobilization. Now we're going to go straight to the motor control exercises or mobility exercises. You have to remember, the exercises are the key to treatment. Cannot just let go without the exercises. Our goal was to improve dorsiflexion. I would ask Megan to turn around and face that way. I want you to put, let's say the right ankle was the problem. She's going to put, you could use a band also. I've used the mobilization belt. This is going to stay at the crease of the ankle again. She's going to bring this leg forward because she cannot move any further. She can use this for stability. If she's comfortable, she can put it forward or backward, doesn't matter. So our goal is to improve dorsiflexion in different angles. That way, and she can try putting that leg behind and then trying to dorsiflex. So this is going to help feed the joint. The goal is to keep the foot flat and then dorsiflex and not go past her toes. Still be able to get the dorsiflexion. This pressure is going to be pulling backwards, so she should be all the way forward so she feels the pressure. In order to improve it, we can use a wedge. So that way we know for sure she's already in dorsiflexion. She's not compensating with her toes and still getting a lot of dorsiflexion. That would be training dorsiflexion, which would be the problem. And most of the patients who come up with ankle pain, knee problems, and foot problems, this is something they're going to lack. So just one exercise and followed by the second exercise where she maintains dorsiflexion and turns side to side, where she can rotate a little to give the ability of the mid-tarsals, talocrural, subtalar joint, the ability to control the motion when she's able to walk. The rotation should be efficient with dorsiflexion. So that completes the treatment options and techniques for all the problems at the ankle joint. Use it with caution. Don't do everything one day for all patients. If you need any information about the bands, tools, or cupping, please feel to comment below. I hope you have a good day. The most important thing after they learn how to dorsiflex is to be able to control and learn the full range of motion of dorsiflexion. That is only possible if they're able to eccentrically lower and control the Achilles tendon and the gastrosoleus muscles. So the best way to improve your tensile strength in your Achilles tendon and also your gastrosoleus is to do an eccentric control step down exercise. Take your foot off of the band. I would like you to turn around and stand on the step. The heels are off the step. They're midway on the foot is on the step. They're holding on to something. They can do it with one leg or both legs based on the irritability. They're going to lower all the way down, push up quickly and then slowly lower it down. That teaches the body how to control eccentrically the dorsiflexion. They might be sore after they do this exercise, but this is the most recommended and the evidence-based exercise to improve your tensile strength in your Achilles tendon. So as you can see, when she drops down, that's a great amount of dorsiflexion she needs to control, and that's a great way to work your tendons. That summates the treatment of the ankle.